Hey, what's up, Burst TV? It's Nancy Tran, dental hygienist and fellow Burst TV star. What better way to kick off Dental Hygiene Month than to help understand and discuss the pH levels of the oral cavity? We always assess our patients' dietary and their saliva risks, and we learn to educate them based on their dietary risk factors on how to better manage and maintain their saliva, the effects of their saliva, whether they have dry mouth or they're at higher risk for root decay. So I commissioned a poll on the most popular drinks that people would like to have tested to see where the pH levels fall on a scale of 0 to 14. So let's dive back to Chemistry 101. What is pH and how is it measured? On a scale of 0 through 14, pH is measured. Anything that's lower than 7 will be more acidic. Anything higher than 7 would be more alkaline, which is basic. So I have pH strips that are going to test into these different drinks for 15 seconds, and we'll be able to measure it on the scale of 0 through 14 based on the color that these strips will indicate after 15 seconds. I'm super excited to see what these results will be, and it's important for us as dental professionals to understand so that we can educate our patients. We have good and bad bacteria in our mouth and our saliva, and depending on the exposures of these drinks, it can affect the levels of our pH. The lower they are, of course, the enamel will definitely start to soften and become weaker, where they can eventually become decayed. So we are going to be testing today black coffee. Black coffee also with 1 tablespoon of creamer, tap water, smart water, C2O coconut water, LaCroix, Dr. Pepper, Arizona sweet tea, Arizona green tea, and then also kombucha. And I thought this was pretty interesting. It's pH perfect water, so they guarantee that during the bottling process it's a pH of 9. So I wanted to see if this was true based on the pH scale. So let's go ahead and get started. I'm going to go ahead and dip all of the strips in first, and then we'll set it aside, and then we'll be able to kind of go over the results together. Okay, so we're going to get started with the black coffee. Okay, so now we have 1 tablespoon of creamer, and we're just going to mix this in with the black coffee here. Alright, so we have tap water next. Smart water. And we have the C2O coconut water. I always find out that my patients, even though they have good oral health habits, they're brushers, they're flossers, but sometimes they get very frustrated because they always come back with root decay or recurrent cavities underneath their margins and their crowns. And upon further dietary assessments, we find out that they sip on sweet tea all day, or they sip on their coffee all morning versus starting and finishing. So now we're on the Dr. Pepper here. So we're on to the Arizona sweet tea, Arizona green tea. So this is the kombucha. And last but not least, let's just see how true this one is, where at the time of bottling, the pH perfect water, it's a pH of 9 at the time of bottling. So I want to see what its pH is after bottling. So black coffee alone, it is on a pH scale of 6. So it's not quite acidic, it's just 1 step down from a neutral. So that's not too bad. Black coffee with 1 tablespoon of cream, a 6 as well. So that 1 tablespoon of creamer didn't really make a difference. Tap water looks like it's a pH of 8. So that's more on the alkaline side. It is above the neutral line. Coconut water looks like it is closer to a pH of 6. LaCroix, a pH of 5. So that is probably going to be a little bit more acidic than the rest that we've tested so far. And then we have our Dr. Pepper. Dr. Pepper is closer to a pH of 3. So Dr. Pepper beats LaCroix in the acidity scale. We have Arizona Sweet Tea. It's a pH of 4. Arizona Green Tea, looking the same, pH of anywhere between 3 and 4. The kombucha is between a 3 and 4. And last but not least, the pH perfect water. Let's see if it holds up to its claim of 9 before bottling. And it looks like it's between a 7 and 8. So it may have lost about 1 level of pH after bottling. So it was kind of a neat experiment. Hopefully this really helps. I hang on to these strips in the office because I'll do saliva testing on my patients, and then also to educate my patients too if they're drinking something, like they come to their dental hygiene appointment and they have a huge big gulp from the 7-Eleven with Sprite or Dr. Pepper, then guess who's getting tested? Just drop it in really quickly with their permission, just to show them what they're exposing their teeth to. But it's not just about coaching our patients and giving them the good oral hygiene habits at home with their brushing and their flossing routines. We really need to dive deeper and assess their oral health habits with their diet and their risk factors. I like my patients to leave knowing that I know what coffee or what tea or what their favorite habits are, because then I can coach them better. It's called pH therapy, neutralization therapy, and pretty much anything that we recommend as far as fluoride and home care products, we want to make sure that it's ideal, a pH of 7 to 8, so that they can prevent themselves from having root cavity and decay. So any denture fissures that we recommend, as long as it stays within a range of 7 and 8, that will help prevent demineralization of the tooth enamel. Patients who are already at risk, who have been compromised and there's an imbalance and they have the bacteria in the mouth that puts them at high risk already and they need active therapy, their pH range for their denture fissures need to be within a 9 to 11. You guys can always do pH testing on the products that you recommend your patients to know, like, okay, this product or this fluoride gel or rinse is at this pH range, so this works well for this patient that's compromised. So hopefully this has really helped you guys have a better understanding of pH, not just because it's chemistry, but it does play pretty well overall in our oral health assessments with our dental hygiene visits and as dental professionals. This is the oath that we take to be able to understand and help our patients. You can get these strips here on Amazon. You get 200 strips for about $8. If you are a Oral ID member for life, your office is an Oral ID member for life, you can get free pH strips from them at no charge, which is what I really like. But the only negative thing about that is the strips only measure from 0 to 7. I wanted 0 to 14 so you can see the true pH levels. So hopefully that helps. I really enjoyed doing this experiment with you guys. All right, thank you. Have a great day. Thanks for watching Burst TV.